My name is Arjan Hehenkamp. I am the General Director for Médecines Frontières, based in Amsterdam, and I've been working for this organization for approximately 20 years now. Mostly in the field, but for the last 8 years in the office here. What we do in Syria is primarily related to surgery. So we have established, after initial period, supporting some groups that were working inside but not having any staff or structures inside Syria because of security issues primarily. We have now got 3 or 4 medical facilities in Syria across the border from Turkey, where we treat primarily people who are wounded because of the fighting. The most recent development is, or the recent developments are that the health system in itself is also collapsing, and hence as a result of that pathologies that were and diseases that were easily treatable in the past are not now anymore, and therefore we have also got to start vaccinating for something like measles, for instance, which is unheard of in a country like Syria, which had that under control already for decades. We are probably one of the few organizations that has its own staff and its own structures in Syria itself. It's a drop in the ocean, so it's completely inadequate compared to the needs of the population. And the fact that we are unable to scale up to the extent that we can address to a reasonable scale the needs of the population has a lot to do with insecurity on the one hand, but also a lack of acceptance by the Damascus authorities on the other hand.
Could you tell something about the humanitarian access negotiations? So how does this work?
Well, the starting point of any humanitarian situation is that access doesn't exist. So it needs to be created, and it usually is created through negotiations, through discussions with the authorities. So for Syria, for instance, you need to have 2 conversations at least. One is with the authorities in Damascus, and the other one is with the rebel authorities, of which there are quite a few. There's not one single rebel authority or opposition authority. There's a number of groups that you have to talk to. But at least 2 conversations, and we, in order to be able to gain access to the opposition-controlled territories, it took us a year of first support from outside Syria towards medical groups within Syria, before we had gained enough understanding and context and confidence of people within Syria in order to be able to put in our own staff. With the Damascus authorities, it is much more difficult because they don't accept humanitarian organizations or many humanitarian organizations. If they do accept them, then you have to work according to their rules and strict control. And they have not allowed MSF, despite our efforts, they have not allowed MSF to come work in territory that they control.